Secrets. You listen to Monster Mo's morning show. It is 6:11 Eagle time on Friday, October 24th. And like I said, I am joined in the studio right now by my special guest, and this is Pamela Ward-Demo. She is the infectious disease physician from AFRICOM Surgeon's Office. Good morning. Thank you so much for being here.
Good morning. Thanks for having me here.
No problem here. Now, we're talking in reference to Ebola, and there's a lot going on in the news right now, and a lot of the listeners, a lot of people out here in Stuttgart are still concerned about that too, because it's definitely a large presence in the news. So we've got a couple questions. I've even posted on our Facebook page. If you're listening right now, you can post your questions to the thread that I've posted about 10 minutes ago and have your questions possibly answered here on the air. So drop me a line, let me know what's going on. But I'm going to go ahead and take the lead. What is Ebola?
Sure, it's a great question. Ebola is a virus. It was discovered in Africa several decades ago, and there's been several small outbreaks since that time in Africa, and currently we are experiencing the largest outbreak that we've had before.
Okay, so why is it so dangerous?
Ebola is what is known as a viral hemorrhagic fever, and can be extremely fatal, with fatality rates anywhere between 60 and 90% without care.
Okay, so it's crucial that we get care for those who may be infected or near those that are infected.
Yes, it's very important that folks that become ill with Ebola seek care and obtain care. There is no cure for Ebola, so care is strictly supportive therapy. However, with early and initial aggressive therapy, we can improve survival rates.
Okay, so how does it spread then?
That's a great question. While it is a very fatal disease, it requires direct contact with a person who's ill and their bodily fluids. So casual contact will not spread the virus. It requires my contact with, say, the blood, diarrhea, etc., of someone who is actually sick with Ebola.
Okay, so just because you happen to be in the area of someone that's known to be infected, you don't take caution, right? But don't overdo it, per se.
Yes, exactly. It takes me actually having contact with the sick person.
Got it. Okay, so in that case, since we're talking about spreading, traveling, how has that been affected, at least with our service members here in Europe? Because there were opportunities for service members here to go and family members to travel to the continent of Africa. Has any of that been restricted now?
Sure. Currently, if you look at the Foreign Clearance Guide, it notifies everyone that travel to the affected countries, Sierra Leone, Guinea, and Liberia, has been restricted to essential travel only.
But we've identified that when traveling, if you see maybe a palm print that's sweaty on a mass transit, that wouldn't be enough to do it.
Well, to continue not touching like we normally do with safe hygienic practices, we don't tend to touch things that are obviously dirty, bloody, etc., and that we wash our hands frequently, and when we don't have soap and water available, that we use hand sanitizer. Fantastic.
Now, we have AFRICOM, and troops from AFRICOM are supporting USAID down there in Liberia and Liberia only.
Yes.
Was that the request of the Liberian government?
Yes, that's correct.
Now, what are they doing there?
They're supporting in engineering, logistics, and training.
Now, they're not everyone's going to be directly involved with treating of patients.
Actually, no, we are not. That is not our role at this time.
With the treatment, what are things to look out for when dealing with Ebola? So, let's say we're coming back here. You already identified that troops that are coming back from the continent are going to have face-to-face time. Why is that?
That's so that we can identify if someone is going to have an issue. We'll identify it very early. That way we can help control the disease, and we can also make sure that that person gets attention rapidly.
Excellent. Now, we also identified that it is flu season,
yes,
and that some of the symptoms are similar.
Yes, they can be initially.
Now, instead of jumping to conclusions to prevent that, what would be the best thing to identify the difference?
Exactly. So the very first thing is we always have to remember you have to have had an opportunity for exposure. So unless you've been exposed to a person who's ill with Ebola, Ebola is not going to be on the list of possibilities. So, and that's most likely going to involve travel to one of the three involved countries.
And then speaking of travel, travel has been restricted to those three countries, correct?
Yes, it has.
And where can we find that information?
That's on the Foreign Clearance Guide. Awesome. And you can Google that and find it the website very quickly.
Excellent. Now, one last thing before we go. Now, is there anything you'd like to identify or talk a little bit about before we close out for the hour?
Just to remember, if folks have questions, that the folks are here to answer those questions, either at the clinic or at the command surgeon's office through your chain of command. And to remember to continue to practice the force health protection measures, the personal protective measures that you've been trained in before deploying.